confirmed today that insurance premiums will go up sharply by an average of 22% next year. Our nightly political panel is back. Guy Benson, political editor at townhall.com, and Susan Ferriccio, chief congressional correspondent of the Washington Examiner. Well, Guy, what about this? I mean, it isn't just that the premiums are going up, right?
Right, so 4 pieces of information for viewers right now. Announced today, and this is the Obama administration's own data. The average baseline plan under Obamacare, on average, will go up by 25% premiums in 2017. The administration announced that 15 insurers will join the marketplaces in 2017.
That sounds like good news.
Except 83 are exiting. About 1 in 5 Obamacare consumers will have fewer than 2 choices when it comes to plans, meaning 1 or 0, 1 in 5. And the administration is now projecting 13.8 million enrollments next year. And I think it's worth remembering
that new enrollments?
Total enrollments.
Total enrollments.
Total enrollments under the Obamacare marketplace, 13.8 million, which is down from what CBO, the Congressional Budget Office, initially projected that by this time they'd be north of 21 million. So this is the White House's own information. This law is failing on its merits.
Susan?
And so we say, why is it failing? Because it's doing what most people predicted it would do, which is attract the people who need the most health care while not attracting the people who don't need the health care, the young and the healthy. They're not signing up for this. And if they're not signing up, they're not paying into the system. So it's costing more and not bringing in enough money.
How much of that do you think, Susan, is due to the fact that you can wait till you're sick before you sign up?
That's a huge part of it. And that's, it's a way that the insurance companies say that's driven the costs up. And people are taking advantage of it. They've already, determined that that's happening in many cases. They've tried to crack down on it by changing the window and the excuses you can use for signing up late, but there's nothing really specific that's helping drive those numbers back down. There's just not enough money coming into the system. So you have the Hillary Clinton talking about, what the solutions might be, and it's just costing more money. It's let's subsidize more of this, or let's make more people qualify for these subsidies. And so it's just basically let's put more into the system.
Taxpayer money, right?
Right, and potentially create this public option.
Public option is basically government medicine.
A federal option where the government would run a health insurance system that people could opt into if they couldn't find something in their own area, if there was no competition.
Now, two ways to look at this guy politically. One would seem to be this thing is failing. It's the signature achievement or the signature legislative achievement of Obamacare. This should be a big issue in the campaign. The other way to look at it is this thing collapses like it's the people who devised it knew it would, and this will make it easier for the left